Uh, so first of all, thank you very much for inviting me to have this occasion to have a discussion on a very, very important topic to me, which is the psychosocial impacts, not only of the pandemic, but all the lessons learned from all the previous large-scale disasters that we have experienced here in Canada. We have conducted several studies, not only my university team, but several other teams all across Canada. And we have also learned in terms of recovery from all of these disasters. So the point today is to see what have we learned so far and how could we apply all of these precious learning to the current pandemic. So just before going further, I want to make sure to acknowledge the amazing work of my research team at the University of Sherbrooke, but I'm also working with several other universities in Canada and in other countries. So for example, the University of Ottawa. And of course, this research project wouldn't be possible without the collaboration of several health organizations across Canada and also elsewhere in the world. So the first part of the presentation will be really about what do we know so far about psychosocial impacts of disasters, so generally speaking. And the first thing we all need to acknowledge is the fact that the pandemic is a disaster or a catastrophe. And as much as any other type of disasters, like for example, we have all heard about the Lac-Mégantic rail tragedy in 2013, but also obviously the Fort McMurray wildfires in Alberta in 2016. And for example, in Quebec, we had very severe spring floods in 2017 and 2019, but I know that this has been the case in other parts of Canada as well. And the pandemic also constitutes or corresponds to the definition of a disaster, which could be defined as any type of event that disturb the human environment in such a way that it exceeds our capacity as a community to function normally. So I think that given this definition, we're all agreed that the current pandemic is definitely a disaster, sorry. And what's interesting here is that whatever we talk about environmental catastrophes or the pandemic, which is much more an infectious disease emergency, we can see that all of these events share a set of common features, going from the fact that they are unpredictable, they all have a sudden onset, at least at the beginning for the pandemic. But this crisis, as opposed to others, have been everlasting since the last year. But it also brings a bunch of fear and stressful feelings and uncertainty and confusion for the general population. It also comes usually with several types of losses, going from human losses, material losses, and of course, financial losses. It comes with either evacuation or confinement, as it is the case during the current pandemic. It also almost all of the time comes with disruptions in terms of services and infrastructures. The government response is usually pretty complex. It also brings a lot of media attention that can also increase the stress level of many people. And the impacts, especially the psychosocial impacts, are usually long lasting, which makes the adverse effect that the entire communities are usually affected by a disaster, and not only the direct victim that have been associated or more directly exposed to a disaster. So for the pandemic, for example, it would be those who had been infected. So of course they could be considered as victims, but we are all victims of the pandemic. And despite the fact that we all can expect that the pandemic will have huge psychosocial impacts, as it is the case for other type of disasters, we realize that in terms of the literature and also the public health practice, these psychosocial impacts are much less recognized and less studied than are the impacts on physical health, for example. And I really like this paper, which mentioned that the mental health issues following floods are thought to be responsible for more than 80% of the total health burden measured in terms of disability adjusted life years. So I'm pretty sure that we're actually not paying attention, like 80% of our attention on psychosocial impacts of the pandemic as opposed to the physical health impacts of the pandemic, right? And I really like also this figure, which shows that the emotional reactions following exposure to a disaster is not expected to be the lowest or the most adverse in the following days or weeks. So you can see here that usually in the first period following the exposure to a disaster, so for the pandemic, it would correspond to maybe March, April, we all have this honeymoon phase where, you know, we have all the rainbows and it's all going to be okay and everything, like the hashtag that we all saw several times. But did you notice that we're not seeing such so many hashtag it's all going to be good or okay anymore, and no rainbows anymore, because we're in the lower part of the curve. So after a couple of months, people get tired, you know, and they they just make the inventory of all the losses and all the accumulated stress over time. And that's come the time to get back to normal, that they realize that they're not so well on the psychological side. And then you can see that the slope to get back to the pre-disaster state can be quite slow to recover. So you can see that it can take as much as a year, and sometimes 2, 3, and 4, 5 years following the end of the disaster to get back to our pre-disaster state. And this will depend on many factors, including all the social support, the governmental support, financial support that we're going to be able to bring to the affected people in the communities. And also, this is true for all types of disaster, but we know that we have to face primary stressors that are typically associated to what we experience during the crisis, but we also need to consider longer term stressors, which are called the secondary stressors. And finally, there's always the anniversary reaction. So we're going to have to deal with this anniversary reactions in 2 weeks, I guess, or less than a month. And we know that 1 year, 2 years, 3 years following a disaster, we're all going to get this, so not everybody, but a lot of people will kind of suffer, you know, all the reminder of all the stress and the painful events associated with this disaster. So this also needs to be considered. So that being said, we have decided, my research team and I, to conduct this very interesting study, which aimed at monitoring the psychosocial impacts of the COVID-19 pandemic here in Canada, but also across several countries around the world. So this is a 2-year project, which is funded by the Canadian Institute of Health Research. And I find it quite original because it's an interdisciplinary and international team that assemble all this very unique projects. So we work with people in the communication science field, political science field, and of course, public health field. We have 3 main axes in our study, but today I'm going to focus much more on the first of the 3 axes, which is the population-based surveys that were aiming to examine the psychosocial impacts and their associated factors. So let's jump into this axis 1. So we initially intended to conduct repeated cross-sectional surveys at the international level. So we had a pilot phase only in Canada in April, then phase 1 and phase 2, which were respectively conducted in June and November 2020. But at the same time, we had this very big interest into our survey here in Quebec from the public health authorities in Quebec. So they funded the additional, so they gave us additional money so that we could oversample Quebecers here. So in September, in November, and actually in February. So I just received the latest database yesterday night, and I just went to bed pretty late because I was really curious about what we found out. So if you have some questions at the end, I might give you some clue about what's happening like currently here in Quebec, and we can expect that this is quite the same thing elsewhere in Canada. And you need to know that all of these surveys are, the recruitment is through a web panel. So it's all an online survey, and people were already recruited through our web panel, which is Léger Marketing here in Quebec. And we also collaborate with several partners across Canada and the other countries. And all of the data that I'm going to show you have been weighted for age, sex, language spoken. So we really think that these are quite representative of the general population of adults in Canada. And we have been looking to several outcomes that have been classified into psychological response and behavioral response. But due to limited time today, I'm going to focus on two psychological outcomes that are generalized anxiety disorder and major depression episode. So of course, these are self-reported symptoms that could predict an anxiety disorder or a mood disorder. And these have been measured using two quite well-known scale that are GAD-7 and PHQ-9. So this figure comes from a published paper so anyway, you'll have the reference at the end of the PowerPoint if you want to know a bit more. And it shows that overall, you can see that Canada, when compared to United States, England, and all the other countries that you can find here, is quite in the middle position, I would say. So we're not too good, not too bad. We have around 30% of the general adult population who it was in June this time. So that in June were presenting or reporting symptoms in line with either anxiety disorder or a major depression episode. And you can see that for comparison in United States, this proportion was much higher. And we're about to submit the results from phase 2 of this international survey. And overall, I can say that the proportion has rise a bit in every countries, but United States, which has known a slight decrease in the proportion of anxiety and disorder, which might be attributable to elections that were in November. That's an hypothesis. Anyway, so in June 2020, we have also looked to a bunch of risk and protective factors that could be predictive of probable generalized anxiety disorder or major depression episode. And again, you'll have all the details of the paper if you want to know more. But what was, I would say, the main point or the main finding in this paper was the fact that among all the factors that have been examined, going from pandemic-related risk factors, infodemic-related risk factors like confusion, false beliefs, mistrust towards authorities, that kind of stuff. All of these were found to be significantly related to anxiety or disorder. But the most important factor, in fact, was a protective factor. So it was the having a strong sense of coherence was associated with 3 times less chance of developing anxiety or depression during the pandemic. So this is a quite strong association. And of course, this is independent of all of the other factors that you can see below. So when talking about sense of coherence, because I'm pretty sure that most of you are not really aware of this concept, and I wasn't really aware of that either a few maybe years ago. And that's really interesting because this is the core concept of the theory of salutogenesis, which was developed, I think in the 80s, something like that, by our colleagues or European colleagues. And this theory aims to examine which factors are contributing the most to the promotion and mental health and physical well-being, rather than simply and always focusing on what creates disease. So we just have to shift our mind towards what creates health, basically. And these researchers and from Europe have found that the core element on an individual aspects or a level would be the sense of coherence, which is composed of 3 elements, which would be our ability to understand and analyze all the informations that help us to better understand stressful situations. Second, it would be the meaning that we give to a stressful situation and the meaning that we give in life in general, so that we feel more comfortable with what's happening, even if we have to face an adverse situation. And finally, and very importantly, or ability or capacity to first identify, but also mobilize available resources to deal with stressful situations. So our capacity to understand, to make sense out of it, and our ability to manage this at the adverse situation by mobilizing all the available resources. So that being said, let's jump into the latest data that we have for Canada and Quebec, with the exception of data that I received yesterday night. So sorry, I didn't have time to adjust the PowerPoint, as you can imagine. But November 2020 is not that far from today. And at that moment, we had the chance to have a pretty big sample in Quebec. So more than 8,000 people here in Quebec, representing all of the health regions. But we also had another additional 1,000 people across Canada, half of it being in Ontario and the rest being in other provinces and territories in Canada. And here you can see, so I'm going to present the prevalence or proportion of adults showing symptoms in line with probable anxiety disorder, and the same thing for probable major depression episode. And the third columns would be the proportion of either anxiety or depression disorder. So if we just look at the bottom line, you can see that almost doesn't make sense, but it's about a third of the adult population that is currently showing symptoms in line with an anxiety or a depression disorder, which is huge, of course. And if we look at the two types of disorders separately, we can see that anxiety is a bit lower in terms of a prevalence as opposed to depression, but both are very high. And we also found some pre-pandemic data at the Canadian level, of course, among adults. And what we found is that the generalized anxiety disorder was estimated to affect about 3% of the general adult population back before the pandemic. And this is 7% for the proportion of adults which were showing signs of probable depression before the pandemic. So of course you can see that there's something clearly happening since the beginning of the pandemic. You can also see that the province of Quebec as a whole seems to be a bit better off than the rest of Canada. And on the other side, you can see that Ontario is displaying very high levels of anxiety and depression. And maybe within Quebec, since we had a pretty big sample, we were also able to stratify the results according to some health regions. And we found out that in Montreal, which is of course our most urban area here in Quebec, we do have pretty high levels of anxiety and disorders as well. But I think that the most disturbing results is definitely this one. So you can see that when looking at the distribution of anxiety and depression according to age, there's something going really bad for young adults. So you can see that as much as 56% of adults aged 18 to 24 years old are currently reporting symptoms in line with either anxiety or depression. So, I mean, it's like the new normal, I would say. So this is very sad, of course. And you can see that as the age groups increase, the anxiety and depression disorder prevalence decrease quite fastly. So the key points that you should remember from all of these results is that 1 in 4 adults in Quebec currently report symptoms consistent with anxiety or depression. It's 1 in 3 in Canada, which reports such symptoms. Unfortunately, being anxious or depressed is the new normal for youth. The situation is worse in Montreal, but also in Ontario. Anxiety and depression levels have clearly increased in 2020 as opposed to the pre-pandemic data that I just showed you. And both the pandemic and the infodemic seems to be influencing this psychological adverse response to the pandemic. But very promising point would be that the sense of coherence, which is our individual psychological resource to face stress, is a very important protective factor. So I'm going to get back to this sense of coherence a bit later, so that we can see how can we work on it, how can we strengthen this sense of coherence. And the good news it's not genetic. So yes, we can do something to increase the sense of coherence. But before going there, I just wanted to look back to previous disasters to see how these results currently observed following the pandemic, not following, but during the pandemic, compared to those of previous disasters in Canada. And you'll see that it's quite interesting. The first studies that I found were those conducted by Agia Pong and the whole team following the Fort McMurray wildfires in 2016. So 6 months following this traumatic event, they sampled 1,500 adults residing in Fort McMurray, and they also measured the anxiety and disorder using exactly the same scales as we did here during the pandemic. And what we observed is that the level of probable generalized anxiety and major depression were quite similar 6 months following the wildfires in Fort McMurray to that observed across the whole Canada and Quebec here during the pandemic. So that makes a lot of sense. But at the same time, one should realize that it means that we are currently as affected by the pandemic as people in Fort McMurray were following the wildfires. So this is quite disturbing. They also noted that young adults following the exposure to the Fort McMurray wildfires were also more affected than the older adults. Regarding the Quebec spring flood, I've been conducting with my team another study. And we also looked at the anxiety and mood disorders, but this time we didn't use the same scale. But anyway, we asked people, are you suffering for anxiety or mood disorders that would be diagnosed by a physician? We also looked at signs of post-traumatic stress, and all of this was conducted a bit less than a year following exposure to the spring floods among a bit more than 3,000 households located in flooded areas. Some of them were directly flooded, so in their living areas. Some of them were simply disturbed, we should say. So it means that they were flooded maybe on the land or garage, or maybe they were evacuated in a preventive manner, or maybe they just lost access to some key services in their community. So they were only disturbed but not flooded. And the remaining were living in the flooded areas, but they were not flooded nor disturbed. And that's interesting because we were able to compare the non-affected, the disturbed, and the flooded people. And what we observed here, and that's pretty clear with the figure, is the fact that we had just under half of flood victims, so the flooded one, who showed symptoms consistent with post-traumatic stress disorder, but also 21% of them reporting an anxiety disorder and 20% a mood disorder, which is quite consistent with what we have observed during the pandemic and the Fort McMurray wildfires. And finally, but not least, the Lac-Mégantic train crash in 2013. So I'm not going to get back to this tragic event, which I've been exposed to and following the community since then. But over time, we have conducted several surveys. So I'm going to talk about the two first surveys, the first one being 1 year after, and the second one 2 years following the event. And again, we have looked at diagnosed anxiety and mood disorders, post-traumatic stress signs, and also psychosocial services received. And you'll see that's quite interesting because what we found first is that anxiety disorders were higher among victims, or those who were directly exposed to the disaster in Lac-Mégantic, as opposed to other people living in Lac-Mégantic and surrounding areas, but less directly exposed to the disaster. But the most worrying finding was that over time, this proportion of anxiety disorders was a bit increasing. So, it was not getting back to normal. It was even increasing over time. We also noted that 2 years following the event, we had as much as 75% of the highly exposed adults who were showing signs of post-traumatic stress, so moderate to severe signs of post-traumatic stress. Of course, all of these persons didn't have the diagnosis of PTSD, but they were still reporting several symptoms in lines with such a disorder, including nightmares, intrusive thoughts, avoiding spaces or things that make you think about the traumatic events. So that means that, you know, the vast majority of the population was still suffering 2 years after the event. But our main concern was the fact that despite that a bunch of people were still really affected by the disaster 2 years following the event, the proportion of them who reported using or consulting psychosocial services, this proportion was declining over time, despite the fact that the psychosocial needs were still very high and even increasing for anxiety disorders. So that's exactly where we realized that yes, psychosocial impacts are huge and can affect a wide proportion of the population following disasters. But it would be wrong to simply think that following such impacts, we need to add more specialized services. We need to do much more than that. We need to work at the community level. So that's exactly where I'm going for the next slides. So how can we strengthen this resilience at individual and community level in such adverse contexts? And this is true for train crash, floods, wildfires, and of course a pandemic. So the good news, it's always the same kind of recipe, and you just need to adapt it to, of course, the local context and culture. So this pyramid, unfortunately, is only in French, but you can easily find it in English if you just write step care model. So the step care model would be maybe a kind of framework to help you if you want to plan the mental health interventions in your community following exposure to a large-scale disasters. So you can see that at the tip of the pyramid, we have specialized services, but then you have all of these frontline services and all these initiatives that we can, or actions that we can promote at the community level to increase the social fabric. And even more at the basis of this pyramid, the lowest layer, you can see the darkest blue one. It's all about considering psychosocial aspects that should be more taken into account in all of our decisions regarding basic services. So maybe it's going to be a bit easier to understand with this slide. So beyond specialized mental health services, we need frontline services, which constitutes of teams working, of course, at the clinical level, so maybe in primary care settings, but also at the community level. At least that's what we have decided to implement in Lac-Mégantic following the train crash. So we realized that we needed to go beyond the clinical settings and do some outreach activities and early detection and interventions actions so that we could, you know, reach out to the population much more than what we could do in clinical settings. Then I'll get back to the social prescription, which is one solution to maybe bond the clinical services and the community services. Psychological first aid training, I'll get back to that. And then the other layer regards the community support and social fabric I was talking about. So we can do a lot of things regarding the community resilience. And if you want to know more about community resilience, I strongly suggest you access this very, very interesting reference, which was Tracy O'Sullivan, which has built this frame of reference regarding community resilience. It can be applied before, during, or after disaster. So the reference is at the end of the PowerPoint. But there's also a bunch of actions that can be put in place to strengthen the sense of coherence. And I'll give more details about that. So regarding the frontline services, I was talking about community outreach. So that's exactly what we did in Lac-Mégantic with the creation of an outreach team that we called Équipe de proximité in French. These are, okay, so this is not reserved for women, but clearly that I don't know why, but they all raised their hand more quickly than men did. So that's the reason why we only have women around the table. We have a social community organizer. We have a social worker. We have a kind of street worker or outreach worker. And we also have a nutritionist and a sport therapist in our team, so that we have really a holistic approach. And, you know, sometimes it's much easier to get into a workplace, for example, by talking about life habits, then talking about, sleep disorders, anxiety, and that kind of stuff. So we can reach out to people in different ways using the different expertise around the table. So you can see all the intervention principles, but mostly we want to act at different levels, from the individuals to the collective. We want to build on previous knowledge. I mean, that's key, because we don't want to reinvent the wheel. We want to learn from other disasters, not only in Canada, but all around the world. That's what we've been doing. We also want to learn from our own experience and share it to the rest of the world. And we also want to work on a salutogenic perspective. So we want to work using strengths and capacities of the communities, rather than simply focusing on what's going wrong and all the risk factors and the problems in the communities. And this way we can promote citizens engagement, empowerment, so much more positive approaches that can help promoting mental health. And if you want to know more about what we've been doing these years, we have created this synthesis, and this is available in English at the end of the PowerPoint. So it's called Promising Initiatives to Mobilize a Local Community in a Post-Disaster Landscape. So we have like 16 different initiatives that have been described in detail, so that maybe you can get some ideas. But I really think that these initiatives can just inspire you, but it needs to be then adapted to your own local community context and needs, and strength and capacities. Then just a few words about social prescribing, which relates again to the second layer of the pyramid, so the frontline services. So how can we better connect the clinical services and everything that happens at the community level? So maybe it could be done by community referral. So this way we can enable health professionals to refer their patients or people to non-clinical services. So this way we can offer them the opportunity to get involved into a range of activities, going from arts activities, I don't know, cooking, gardening, sports involvement. So everything is possible. So of course, these days it's a bit harder, but it's still possible to be creative and find ways to get involved as a citizens. And we can expect that over the next few weeks and months, it's going to get easier and easier. Then what we've been doing in Lac-Mégantic these days is that we're recruiting of course, volunteers, so the citizens at the community level that shows interest into learning more about how can I help my friends, my neighbors, my colleagues who are showing signs of distress. So we're offering them the psychological first aid training. In fact, we're not offering them. This is the Canadian Red Cross who is actually doing it, but we're just connecting these people to the training online. And we're also creating a kind of network between these citizens, so that if they face any issues or they need to share about their experience, they can share it all together, and of course with our outreach team. And we can serve as a link toward the clinical services if, of course, we meet somebody who's showing very important signs of distress. Then we're also working a lot these days on how can we better support the workforce. And I'm specifically thinking about the healthcare workers, because our studies, I didn't talk about this earlier, but our study also found that these healthcare workers were showing much more signs of anxiety and depression than other adults in Canada, in Quebec, and all across the planet. And of course, we think that these people, as any others, they have the right to maintain a good psychological health. But also, if we don't do anything, we're just going to face a workforce flight due to fatigue and stress. And finally, if we want to increase community resilience, we need to make sure that these people, which are working at the front line on an everyday basis with all this population, if they are not feeling well, how can we expect them to offer a good service to the population? So contributing to increasing the community resilience. And to do so, there's a lot of way we can better support the workforce. But one initiative that we've been working on recently, and it's only in Lac-Mégantic, I mean that I know that it's elsewhere in many other workplaces, but we've been building a peer support group. So this consists of putting all together some employees that have a common experience and that are willing to help each other. So just by listening, taking care of, by showing mutual respect and compassion and shared responsibility. So all these very nice principles that help the people attending this group to break isolation and to feel that they can really connect with others to get better through this the very difficult times. So if you want to know more, you always have the link at the bottom of the slide. And then my main, not main, but my the topic I like the most, so sense of coherence, because we have been working. So everybody was asking me over the past year. So okay, you said that sense of coherence is key in protecting against anxiety and disorder in times of pandemics. So, but what can we do to strengthen this sense of coherence? So we've been doing a literature review, and the results of this review has been published in this document that you can see here. And again, the reference is at the end of the PowerPoint. And basically, we found out through the literature that any type of interventions that involve a reflection activity and empowerment could contribute to increase the sense of coherence. So for example, it could be artistic or cultural activities that if it's made with purpose of increasing the sense of coherence, it can bring people to, get deeper into their emotions and their thoughts and, realize some things that they haven't realized yet. And of course, by being involved into these activities, they get power back over their lives. So this can increase the sense of coherence. So I'm going to give you a concrete example to make it more easier to understand. So for example, in Lac-Mégantic, we've been working on the Photo Voice project. So this project, overall, it means we aim to provide a camera, or people could also just use their iPhones to take pictures about some things that makes them proud of being from Lac-Mégantic. We just wanted to shift the perspective that Lac-Mégantic is only a tragedy. And so through this, the picture taking, people also, after that, they just get back through a group meeting and they had to put a voice on their pictures. This is why it's called the photo voice. So through the voice, they had to express their feelings about the pictures and why did they choose to take this picture rather than another one. And this is amazing because it's quite simple to do. And what a participant said is that we could express our sadness or emotions openly because we were welcome without criticism. At first, it was quite emotional, but as you meet more often, that excess emotion was transformed into something lighter. It did me immense good. It make a big difference. So this is quite inspiring, right? Another thing that we're working on actually in Lac-Mégantic is the storytelling things or project. So this is quite simple again. So we just invite some citizens here in Lac-Mégantic to participate into a narrative interview. So we have like 1 or 2 open questions about how have they experienced this whole adventure of related to the pandemic. So what were their feelings? What actions did they take? What lessons did they learn from all this very unique year? And by just taking this step back and having the occasion to express themselves, it contributed to their own mental health well-being, but also by putting all together all these learnings from all of these different citizens, we were able to build a collective learning from the pandemic and also to contribute to the community recovery by making people feel that they belong to this community, that they can relate to some of the stories that have been shared in the community. And finally, regarding communication strategies, I think that this is more at the basic of the pyramid, but this is so important. So some of the times we work very hard at the community level and clinical level to, promote mental health and prevent mental disorders, but we forget about all of the other sectors of the society, which can contribute in a positive or a negative way in mental health disorders. So we need to realize that every time that we speak in the media, we can increase the confusion, we can contribute to false beliefs, we can contribute to stigma. And, by always talking about the number of death, hospitalization, and everything, we're not putting solutions forward and we're not promoting goodwill. So, there's a way that could be rethink about communication strategies regarding the COVID. And one thing that we've been working on in my health region is a door-to-door operation, which is conducted by med school students. So that's very interesting. They do it on a volunteer based. And what they do is they just go they reach out to the population, just say, hey, do you have any questions about the COVID, or do you simply want to express how you feel about everything? So basically, they're there to just listen to the population and try to maybe provide some information and maybe contribute in decreasing some false beliefs and increasing trust to authorities. And this, I think, is key, that kind of intervention to flatten not only the pandemic curve, but also the infodemic curve. Because without working on the infodemic, I don't think we're going to achieve our goal to reduce the psychosocial impact. So we need to address all the pandemic-related issues, but also, of course, the infodemic-related issues. So my key messages today, and I hope that's what you understood, that first of all, many, and that's quite unfortunate, but many of us are already affected by the pandemic, especially young people and essential workers, and mostly people living in urban areas. We also saw that these psychosocial impacts could be felt for months or even years if we don't do anything. We also saw that the health system is, of course, needs to be involved, but it cannot be responsible for the whole psychosocial recovery operation. A preventive and even a promotion health approach should be offered directly in living environments rather than clinical settings. And most importantly, I would say, in extraordinary situations, we need to innovate. We need extraordinary solutions. So that's the reason why we thought of, Photo Voice Project and that kind of stuff, because it's obviously not in my med school training that I've learned that kind of strategies, but it's when you have to face like adversity that you realize that you need to think out of the box if you really want to help the community. So I'm concluding by saying that to adapt well, I think that we should all realize that we need to develop a common understanding of risk. And this is true for health partners, but also municipal affairs, schools, the private sector, so everybody. And we need to work together in the search for solutions. So we need to shift from a disaster management perspective to a disaster risk management perspective. We've been saying that for a couple of years now, but I think that it has never been more true than now during the pandemic. So you'll have access to the PowerPoint, I guess, and all the references are here right there. So I'm going to stop the screen sharing.
Great. Thanks so much, Melissa, for the fantastic presentation. So now we'll go to questions. So the first one is about the prevalence of anxiety and depression by age for other disasters.
Yeah, I think that the pandemic, the gradient between the youngest ones and the oldest ones, it's impressive. I mean, it's much larger than what we have observed in previous disasters, but this is also true. And this was observed, for example, in the Fort McMurray wildfires, that the younger adults were still showing higher levels of anxiety and depression as opposed to older adults. So this is not a new phenomenon, but I think that the gradient is much higher here during the pandemic, and this could easily be explained by the fact that, you know, the sense of loneliness, isolation is perceived as much more difficult for young adults than it is for older ones. So I think this is one of the main reasons. And all the, I don't know what to say, tele study, so remote study, which also is perceived very, very bad among the student population. So this is just a couple of reasons, but and also the infodemic is affecting much more young adults, and we have seen that in our study. So they are much more prone to mistrust in authorities, much more prone to using informal sources of information to get informed. So, you know, the YouTube or social media, or just by talking to a loved one about the pandemic. So we all know that if you really want to understand what's going well, if you want to increase your sense of coherence, the first thing is to have access to the right information. And young people are not really inclined in, you know, looking at the formal media sources. I mean, much less than older adults, for example.
Thank you. So next question, if there are limited resources and funds available in a community, what strategies would you suggest are most effective or most important to invest in?
Okay, because there's something really amazing that's happening currently in Quebec. So that sounds weird to say, but I don't think we're going to have that much issue with financial and human resources, because one thing that happened, and I really hope, and maybe you can try to advocate for similar interventions across Canada, but at the beginning of November, or maybe in October, anyway, I had the chance to discuss with the minister, the team of the minister, Lionel Carman, who's in charge of all the mental health services here in Quebec. They were really interested into our study results, but also into our recommendations. And that's where I had the chance to present all of the things that have been done in Lac-Mégantic, and they were pretty impressed about that. So I just couldn't, I just still can't realize that, but they said, how much would it cost if we want to implement such kind of outreach approach or team all across Quebec? And I said, well, we have about 100 territories, let's say 250,000 per territory. So it would be 25 million. They said, oh, that's quite a big amount of money. And then they just called me back maybe 2 weeks after that and said, you know, we've been thinking about this and we'll take it. So we'll implement outreach teams all across Quebec. And that's for real. I mean, this week I'm working on it. Like, we're giving webinar, we're starting the project. We've been recruiting kind of coordinators for each of the territories across Quebec. So this is real. We're kind of doing what we've been doing in Lac-Mégantic, but this time all across Quebec. So that's what I think would be the best thing to do. And honestly, 25 millions, it sounds a huge amount, but this is nothing if we can prevent social issues, psychological issues, loss in productivity, etc. All the problems as parents, if we're not able to take care of our children the right way, they can also develop other problems. So I mean, I'm fully convinced that this money is going to be a good investment. So if you want to know more, just write to me at melissa.genereux@sherbrooke.ca, not melissa.genereux, sorry, at sherbrooke.ca, sorry. And I could provide more details about this amazing project we're working on.
Thanks, Melissa.
I don't want to make people jealous. Sorry, I know that you're like, we wish we would have this thing, but you know, sometimes just because Quebec is doing it, maybe it can inspire other provinces to do the same thing.
For sure. Would you like me to put your email address in the chat box so people could contact you? Okay, great. So next question. We have quite a few questions. We might not be able to get through them all, but we'll do as best we can. Next question is about the door-to-door operation. Were particular communities picked, or how were decisions made? Everyone or some? The door-to-door operation, yeah. For what reason?
At the beginning, we decided to prioritize the neighborhoods that would have a couple of characteristics. So some evidence that the community transmission of COVID would be increased. So we felt that these people would be maybe more, open to have this discussion about COVID since they've been exposed to this situation in their neighborhood. Then we also look at the literacy level. So of course we don't have like a specific measure for each neighborhood, but looking at the education level, income, mean income level, that kind of stuff. And the neighborhoods who were having high levels, high proportions of immigrants, for example. So by taking all of this into account, we are certainly prioritizing this type of neighborhoods. But very recently, we just decided to also focus on maybe more uh, um, affluent neighborhood, but with older people, more isolated people. So I think that it really depends what we the resources we have, of course, and the objectives that are pursued. But if we want to maybe decrease the gap, the social gap that have been, of course, increased since the beginning of the pandemic, I think that prioritizing the neighborhoods with low literacy level would be a first good step.
Thank you. Next question. Do you think that those providing care or resources to others have common understanding, or as in the general population, there are those who have diverse views?
Where is the question? Because I'm not sure I really understand it.
Yeah,
well.
I'm not. Sorry, I'm.
Okay,
Yaya,
I
if
see
you
it.
could,
Like, do you think
do you
that
see it? Okay, it's from Yaya.
those providing care? Okay. So those who are providing resources and cares have common understanding. Yes, I do. I mean, I hope that we, like for example, the outreach team in Lac-Mégantic, what we do at the beginning, we came from very various fields of expertise. Social workers. I'm a public health physician, a community organizer. So we were quite different, and what we decided to do is and we did the same thing with all the community partners, like I said, the previously municipality, the school board, etc. And all together we had several meetings over time so that we would build our common understanding of the situation, because who are we to decide what's the problem now, and also what are the capacities and what are the strengths that we can build on. So all of this understanding was built over the time through a process involving all of the citizens and the community partners. So this is like an ongoing process. And one thing that I realized over time is that this process is even more important than the results or the finality that comes out of the process. So just taking your time and doing it in an empowering way and building on collaboration principles and good communications between partners, all of this, by doing it, you're creating health and well-being, because people, the trust is building. That's where all the good and creative ideas are being born, by working all together with different vocabulary and visions and fields of expertise. And that's where all the magic happens. At least that's what we have observed in Lac-Mégantic. I don't know if it answers very well to the question, but that would be my answer.
Okay, thank you. So next question, which variables did you use to weigh your cases? We're conducting a survey on the impacts of COVID-19 measures on adults with chemical sensitivities. We have a sample of just 100. Should we weigh cases to represent the Canadian population, or is the sample too small?
Yeah, I'm not sure with 100 I would do it, because it depends really of the goal. So the weighting, I've always said that when you weight data, if by weighting the data you get critically different results, it means that maybe it's not such a good idea. So by waiting, to me, it's just to make sure that overall maybe that women were over represented as opposed to men, and maybe that young adults responded a bit more than older adults. So by waiting, you just balance your sample. But with only 100 people, I'm pretty sure that it's not that representative of the general population or the Canadian population. But the best way would be that we are studying this sample, and this sample represents which population, so maybe of one city or one setting or one clinical setting, or I don't know what setting we're talking about here, but I think that would be more appropriate to work this way. That's a suggestion.
Thank you. Okay, next question. Are there differences in how you would approach building community resilience in larger cities like Montreal?
Yeah, very interesting. I mean, I've not been involved directly into, building community resilience in larger cities, even though I come from Montreal, but these days I'm working in the Eastern Townships. But I mean, it's always, what I found out over time is that when you don't know, you feel that, oh, I have no clue what to do. That's exactly how I felt, by the way, at the beginning in Lac-Mégantic. And then I realized that that's normal. I don't know what to do because who I am to know what to do. The community knows, the citizens know. So the only thing that we can do is just being helpers, So just try to organize, create opportunities so that people can share together and develop this common understanding we were talking about. So, and by doing so in Lac-Mégantic, I didn't have the time to mention that, but we did what we call a reflection collective day, a collective reflection day. So during a full day, we had this very, very important meeting with all key partners in Lac-Mégantic. And through the day, we had the occasion to build like the timeline, historical timeline of all the good things that we've been doing on an intuitive basis from the beginning of the tragedy. And then we just projected ourselves in the future and say, okay, what do we want? So what's missing? What could we do differently? So based on our learnings from the first 2 years, for example, what could we do more? And during this single day, at the end of the day, we were able to say, okay, we need an outreach team. That's where the idea of creating an outreach team emerged, because I didn't know at the beginning that we were about to create this team, but that's what partners all put together, not decided, but realized that we needed to shift our approach from a clinical setting approach to a community setting approach. So that's just an example to say that if you don't know what to do, that's just a good sign, and just don't try to know what to do, just try to know what to do with the community so that the process can create innovation, collaboration, and very good ideas.
Okay, thank
you. That's always my answer. Sorry, go ahead.
Oh, go ahead.
No, I was done. Sorry.
Okay, so I think we'll leave time for one more question. I will send you the rest of the questions, Melissa, so that we can you can reach out to them, and I'll send you the email addresses and whatnot. So last question, does data collected to date give any indication of how experiencing a prior traumatic event at disaster scale might influence current psychosocial outcomes?
So a prior disaster before the pandemic, I guess? Yeah, I know. I wish I would have asked this question in our questionnaire for the pandemic, but and we didn't. So I cannot directly answer to this question based on our current survey. But we did so for the floods, because in the Quebec spring flood in 2019, so as I said, we monitored the psychosocial impacts 1 year after, or almost 1 year after, but we had questions about, is it the first time you were flooded in spring 2019, or were you previously flooded in the same neighborhoods or in another neighborhoods? So have you ever been flooded? And what's very interesting is that those who were already flooded were showing less signs of anxiety, post-traumatic stress disorder, and mood disorders as compared to those who were only exposed to a flood in 2019. So yeah, with these findings, we realized that that makes kind of sense, that if you have been experienced previously a disaster, you have probably first increase your sense of coherence, not for everybody, but for most people, because you just realize that this time you know how to get the right information, or at least you develop some ways to have to better understand what's happening, have access to the right information, to have take a step back to realize that, okay, that's a hard time, but things gonna get better, and keep the faith that things gonna improve, because you've been there previously, and then what are your resources and how you can mobilize them. And by resources, I'm talking about your internal resources, but also, of course, your external ones. So I'm pretty sure that if you've been through another disaster, and if it went pretty well, I mean, if it was a disaster, I mean, if you didn't get any support and you didn't develop any tools, of course, I'm not sure it's going to be a good thing to be exposed a second time. But if you've been pretty well through the first disaster, you'll just get stronger. So the key message here is that if we go as a whole country pretty well through the pandemic, so we need to work really hard over the coming months. I have a pretty good faith that we're going to get much stronger as a country to face any other type of maybe climatic event that are much more likely to occur in the coming years than another pandemic. I hope so. I mean, I also that we won't have to face another pandemic, but of course, I'm not hoping that we're gonna face extreme weather events. But we all know that it's gonna happen anyway. So let's get prepared.
Mm-hmm. Perfect. Great. Thank you so much, Melissa, for your excellent presentation and for your time today to talk to us about your work. And thank you to all the other attendees for joining us today. I will send you, all the slides and the recording will be posted on the NCCEH website by next week. And I have shared a link to the evaluation survey. Please help us fill it out so we know what you thought about this webinar. And thank you all for coming, and enjoy the rest of your day.